Hi, this is Dr. Keith Lewis of ThyroidColumbus.com. A common question asked by many of our patients are, why am I constipated? I have patients that see me oftentimes that don't have bowel movements except for maybe once a week or once every 2 weeks. I had a patient a couple of months ago. She said she had a bowel movement once a month, and it was a very difficult bowel movement. Now, this obviously isn't normal. Typical transit time for food to be eliminated out of your system from the time you ingest it is usually anywhere from 12 to 24 hours. So yes, most people should have a bowel movement at least once a day. That's normal. Many doctors will say, well, if you don't have it but once every 2 days or 3 days or once a week, that's just normal for you. Well, let me tell you, that's not normal for anybody. Again, 1 to 2 bowel movements per day is the ideal. What could be the cause of that? Well, it could be you're not drinking enough water or enough fluid. I have other patients who haven't been eating enough fiber, and oftentimes just increasing water and fiber intake takes care of the problem. For some, it doesn't. And for those patients, we need to look a little deeper as to the why behind they don't have proper bowel function or regular bowel movements. One area of concern that we find very commonly is the thyroid. A low-functioning thyroid in particular, and hypothyroidism is a real common problem among Americans, especially American women. Constipation and chronic constipation is one of the most common symptoms experienced by low-functioning thyroid. So to get a better handle or idea of how your thyroid is functioning, a complete blood panel of thyroid testing should be performed. This can be performed by your family physician, but again, a complete panel needs to be performed. What does a complete panel consist of? It should consist of at least a TSH, a free T4, free T3, total T3, TPO, thyroid binding globulin, as well as a reverse T3, and possibly even thyroid uptake of T3. So, if you're having chronic constipation and you're not doing or getting any result with what you've been doing, perhaps you consider the thyroid. If you want more information, contact us at ThyroidColumbus.com. Until next time, this is Dr. Keith Lewis.